Hi, my name is Inez Rivera, and I'll be talking to you about adolescents or young adults and HIV, AIDS, unplanned pregnancies, and STIs. Although sex may be fun and gratifying, many responsibilities come with it. In 2009, over 400,000 girls in the U.S. Gave birth, and they were between the ages of 15 and 19 years old. That is one of the highest birth rates of teen moms in any developed country. As a nurse working in the correction setting, we see a lot of patients come in with uncontrolled, untreated, chronic healthcare conditions, some of which are STIs, HIV, and unplanned pregnancies. It is our job to report these new diagnoses to the patients and provide better education so that we can prevent it in the future. Identifying risks can equal better protection, better education, and better assistance programs to decrease the overall contraction of HIV, AIDS, and unplanned pregnancies. Young adults account for the majority of where HIV, STIs, AIDS, and unplanned pregnancies occur. According to the Pediatric Archives of Pediatric and Adolescent Medicine, in 2007, 48% of high school students admitted to having sexual intercourse. Of those 48%, 40% stated that they did not use any condoms in their last sexual intercourse. No use and inconsistent use of condoms has led to over 19 million new cases of STDs each year. Of half of those cases, it occurred between people among the ages of 15 to 24 years old. Adolescents in the U.S. account for 14% of the diagnoses of HIV and AIDS in the U.S. Knowing the population at high risk can lead to better preventative measures before sex begins. Risks of unprotected sex can lead to life-altering infections, diseases, and unplanned pregnancy. They can be life-altering and lifelong. STIs that go untreated can lead to chronic pain, odors, sterility, and even death. Abstinence is the best preventative way to not contract STIs, HIV, AIDS, and unplanned pregnancies, but preventative measures such as condoms and birth control can assist in decreasing the overall contraction of these things. Condoms have been shown to be 98% effective in the preventative contraction of HIV, AIDS, and unplanned pregnancy. Combination therapy of condoms and birth control is the most effective in unplanned pregnancy. Knowing the facts is the first step. Knowing the facts is the first step. Targeting the high-risk population is the next. Education is one way to assist in the decreasing contraction of HIV, AIDS, and unplanned pregnancies in young adults. The Archives of Pediatric and Adolescent Medicine shows that Safer Choice is a 2-year high school-based HIV, other STDs, and pregnancy preventative program for high school students. It has recently been identified as a program that works by the Center for Disease Control and Prevention. The primary aim of Safer Choices is to reduce the number of students engaging in unprotected sex while they're in high school, and providing contraception for students that are sexually active. Studies have shown that students participating in sexual education courses are less likely to engage in sex and more likely to use condoms when they do engage in sex. Although abstinence is the safer sex being taught in schools has led to the decrease in contraction of HIV, AIDS, STI, and unplanned pregnancy. Implementing education and programs to assist young adults have been seen to decrease the overall high-risk behaviors and contraction of HIV, AIDS, and unplanned pregnancy.